Stroke and overview. A stroke occurs when the blood supply to part of the brain is interrupted or reduced, preventing brain tissue from receiving oxygen and nutrients. Without immediate treatment, brain cells begin to die, leading to potentially severe consequences. 1. Types of stroke. A. Ischemic stroke, caused by a blocked or narrowed blood vessel, often due to a blood clot or fatty deposits. Subtypes: thrombotic stroke, caused by a blood clot forming in the arteries supplying blood to the brain. Embolic stroke, caused by a clot or other debris that forms away from the brain, e.g. heart, and travels to the brain. B. Hemorrhagic stroke, caused by bleeding in or around the brain due to a ruptured blood vessel. Subtypes: intracerebral hemorrhage, bleeding directly into the brain tissue. Subarachnoid hemorrhage, bleeding in the space between the brain and the thin tissues covering the brain. C. Transient ischemic attack, TIA, mini stroke, temporary blockage of blood flow to the brain, typically lasting minutes to hours without causing permanent damage. 2. Causes and risk factors. A. Causes: ischemic stroke, atherosclerosis, blood clots, or irregular heart rhythms, e.g. atrial fibrillation. Hemorrhagic stroke, high blood pressure, aneurysms, or trauma. B. Risk factors: modifiable, hypertension, smoking, obesity, sedentary lifestyle, high cholesterol, diabetes, and excessive alcohol consumption. Non-modifiable: age, risk increases after 55, family history, and prior stroke, or TIA. Act symptoms of stroke to recognize stroke symptoms. Face drooping, one side of the face droops or feels numb. Arm weakness, inability to lift one arm. Speech difficulty, slurred or garbled speech. Time to call emergency services. Immediate action is critical. Other symptoms include sudden confusion, difficulty understanding, or vision problems. Severe headache with no known cause, difficulty walking, dizziness, or loss of balance. TASHR 4 diagnosis, imaging tests, CT scan or MRI to detect brain damage or bleeding. Blood tests, check for clotting issues or underlying conditions. Electrocardiogram, ECG, identify heart conditions like atrial fibrillation. Angiography, visualize blood vessels in the brain. Immediate treatment. A. Ischemic stroke, clot-busting medication, TPA, administered within 4.5 hours of symptom onset to dissolve clots. Mechanical thrombectomy, surgical removal of the clot using a catheter. B. Hemorrhagic stroke, surgery, repair aneurysms or remove blood pooling in the brain. Medications, lower blood pressure and prevent seizures or spasms. -6. Post-stroke recovery. Recovery depends on the severity of the stroke and timely intervention. Rehabilitation focuses on regaining lost skills and preventing complications. A. Physical rehabilitation. Physical therapy regains strength, balance, and mobility. Occupational therapy, learn adaptive techniques for daily activities. B. Cognitive and speech recovery. Speech therapy, recover communication skills if speech is affected. Cognitive therapy, improve memory, problem solving, and focus. C. Psychological support, address depression, anxiety, or frustration with therapy or counseling. D. Lifestyle changes, adopt a healthy lifestyle to reduce the risk of recurrence. 7. Long-term management and prevention. A. Lifestyle changes. 1. Diet. Adopt a heart-healthy diet rich in fruits, vegetables, whole grains, and lean proteins. Limit salt, sugar, and saturated fats. 2. Exercise. Engage in at least 30 minutes of moderate exercise most days. 3. Quit smoking and alcohol. Smoking damages blood vessels. Excessive alcohol increases stroke risk. B. Medication. 1. Antiplatelet drugs. Aspirin or clopidogrel to prevent clot formation. 2. Blood pressure control, ACE inhibitors, beta blockers, or diuretics for hypertension. 3. Cholesterol management, statins to lower LDL cholesterol levels. 4. Diabetes management, maintain blood sugar levels through diet, exercise, and medication. C. Regular check-ups, monitor blood pressure, cholesterol, and glucose levels, routine imaging or heart assessments if at high risk. D. Manage underlying conditions. Treat atrial fibrillation, sleep apnea, or any cardiovascular issues promptly. 8. Effective therapies. 1. Mind-body techniques. Yoga, Tai Chi, or meditation to improve balance and reduce stress. 2. Assistive devices. Braces, canes, or walkers for mobility support. 3. Virtual reality therapy. Emerging tools to aid in motor skill recovery. 9. Emergency preparedness. Know your risk. Discuss with a doctor if you have multiple risk factors. Create a plan. Identify local stroke centers and keep emergency numbers accessible. Educate family. Teach them to recognize stroke symptoms and act quickly. Task 10. New research and innovations. 1. Stem cell therapy. Potential to repair brain damage by regenerating neurons. 2. Neuroplasticity training. Enhancing the brain's ability to reorganize and form new connections. 3. AI-assisted diagnostics. Faster and more accurate stroke identification through imaging. Summary. Stroke is a medical emergency requiring immediate action to reduce brain damage and improve recovery outcomes. Effective treatment includes clot removal or managing bleeding, followed by comprehensive rehabilitation. Adopting a healthy lifestyle, managing risk factors, and regular medical care can prevent recurrence. Would you like a personalized stroke prevention or recovery plan? Personalized stroke prevention and recovery plan. 1. Stroke prevention plan. A. Healthy lifestyle habits. 1. Balanced diet. Follow a Mediterranean diet rich in fruits, vegetables, whole grains, nuts, seeds, and olive oil. Lean protein sources like fish and poultry. Limit processed foods, sugary snacks, and excessive salt, saturated and trans fats. 2. Regular exercise. Engage in 30 minutes of moderate exercise, 5 days a week. Aerobic activities, walking, swimming, or cycling. Strength training, twice a week. Stretching or balance exercises, yoga or Tai Chi. 3. Hydration and moderation. Drink plenty of water throughout the day. Limit alcohol to no more than 1 drink per day. Quit smoking if applicable, as it damages blood vessels. B. Medical management. 1. Monitor key metrics. Blood pressure. Aim for less than 120/80 millimeter Hg. Cholesterol. Keep LDL levels low and HDL levels high. Blood sugar. Maintain a healthy range if diabetic or pre-diabetic. 2. Regular health screenings, annual physical exams, heart health checks for atrial fibrillation or other cardiac issues. 3. Medications if prescribed, antihypertensives for high blood pressure, statins for cholesterol management, antiplatelet drugs such as aspirin to prevent clot formation. C. Stress management. 1. Practice mindfulness techniques, meditation, 10 minutes daily, deep breathing exercises. 2. Create a work-life balance, prioritize time for relaxation and hobbies. 2. Stroke recovery plan. If recovery from a past stroke is needed, the following steps can aid rehabilitation. A. Physical rehabilitation. 1. Physical therapy, exercises to improve strength, balance, and mobility. Focus on rebuilding movements in affected limbs. 2. Home exercises, gentle stretching to prevent stiffness. Practice standing or walking with support. B. Cognitive and speech therapy. 1. Cognitive exercises, memory games, puzzles, or brain training apps. 2. Speech therapy. Work with a speech-language pathologist to regain communication skills. C. Emotional support. 1. Therapy and counseling. Address feelings of frustration, anxiety, or depression. Join support groups for stroke survivors. 2. Positive reinforcement. Celebrate small milestones to stay motivated. D. Adaptive tools. Use assistive devices if mobility is impaired, canes, walkers. Explore home modifications for safety, grab bars, ramps. Tracking and monitoring. A. Daily log. Track blood pressure, diet, and physical activity. Note any new symptoms or concerns. B. Bi-weekly goals. Set short-term goals, such as walking for 10 more minutes each week, or adding a new vegetable to your diet. Regular checkups. Schedule follow-ups with your doctor or specialist to adjust your care plan. Adjust for emergency preparedness. Learn the fast signs of a stroke and educate family or caregivers. Keep emergency contact numbers easily accessible. Would you like this plan customized further for your current health or specific lifestyle?